Kilby Correctional Facility is Alabama's prison intake center and the home of the Alabama Department of Corrections Infirmary. There is one full-staff doctor. The Southern Poverty Law Center, a nonprofit legal advocacy organization, filed a lawsuit in June of 2014 against the Department of Corrections for ignoring the medical and mental health needs of its inmates by being severely understaffed. Judge Myron Thompson ruled that the Department of Corrections' insufficient staffing was a violation of the constitutional ban on cruel and unusual punishment, and in 2017 ordered that the staffing be increased by 75%. By July of 2018, staffing had all been increased by 65%. And without these services, people are suffering. Alabama also has a devastatingly high suicide rate, and it's been higher than the national average since 1990. Those in incarceration who also suffer from mental illnesses are at increased risk of dying by suicide. According to the Southern Poverty Law Center, since the start of 2018, 4 people in the Department of Corrections custody, 3 in solitary confinement, and 1 on death row have died by suicide. Mara Morris, senior supervising attorney for the Southern Poverty Law Center, claims that it is common for mentally ill prisoners to be isolated, put in solitary confinement, which has led to the increase in suicides. How can we as a community get involved in eliminating the stigma around mental health and making sure people get the support they need, as well as advocating for the proper mental health services of those in prison?
So, what do you think about the state of mental health services in Alabama prisons?
I personally think that the mental health services in the Alabama prisons is awful. It definitely needs improvement. The way that it's set up is not anywhere the way that it needs to be. It's definitely lacking the way that it's set up. They're not getting the services that they need. People outside of prisons have much more opportunities to get the help that they need. There are much more resources for them to get the help that they need. They have the therapists, they have medications that they can get, and then when you're in prison, you're not seen as equal in that way. And just because you're in prison, you shouldn't be seen as an unequal. You have a mental health disorder, just because you're in prison, you shouldn't be seen as an unequal. So being sent to solitary confinement shouldn't be seen as the result of that. You shouldn't just be sent there because of your mental health disorder.